We have chapter 21. We're going to start with cataracts. If present in both eyes, one cataract may affect the person's vision more than the other. Although most cataracts are age-related, they can be associated with other factors. These include blunt or penetrating trauma, congenital factors such as maternal rubella, radiation or ultraviolet light exposure, certain drugs such as systemic corticosteroids or long-term topical corticosteroids, and ocular inflammation. In addition, the patient with diabetes mellitus tends to develop cataracts at a younger age. Glare is a result of light scatter caused by lens difficulties, and it may be significantly worse at night when the pupil dilates. The visual decline is gradual, but the rate of cataract development varies from patient to patient. Diagnosis is based on decreased visual acuity or other complaints of visual dysfunction. The opacity is directly observable by exam or slit lamp microscopic examination. A totally opaque lens creates the appearance of a white pupil. You can look at Table 21-2 for other diagnostic studies helpful in evaluating cataracts. The presence of cataract does not necessarily indicate the need for surgery. For many patients, the diagnosis is made long before they actually decide to have surgery. Non-surgical therapy may postpone the need for surgery. The patient may be willing to adjust his or her lifestyle to accommodate for visual decline. For example, if glare makes it difficult to drive at night, a patient may elect to drive only during daylight hours, or to have a family member drive at night. Sometimes informing and reassuring the patient about the disease process makes the patient comfortable about choosing non-surgical measures, at least temporarily. Because almost all patients have local anesthesia, many physicians and surgical facilities do not require an extensive preoperative physical assessment. However, most patients with cataracts are older adults and may have several medical problems that should be evaluated and controlled before surgery. Almost all patients with cataracts are admitted to a surgical facility on an outpatient basis. The patient is normally admitted several hours before surgery to allow adequate time for necessary preoperative procedures. The patient will receive dilating drops and a nonsteroidal anti-inflammatory eye drop to reduce inflammation. One type of drug used for dilation is Mydriatic, or MYDRIATIC, which is an adrenergic agonist that produces pupillary dilation by contraction of the iris dilator muscle. Another type of drug is a cycloplegic, which is an anticholinergic agent that produces paralysis of accommodation by blocking the effect of acetylcholine on the ciliary body muscles. Cycloplegics produce pupillary dilation by blocking the effect of acetylcholine on the iris sphincter muscle. The patient may receive preoperative anti-anxiety medication if indicated. Cataract extraction is an intraocular procedure. The interior capsule is open and the lens nucleus and cortex are removed, leaving the remaining capsular bag intact. In extracapsular extraction, the surgeon removes the lens nucleus, in which the nucleus is fragmented by ultrasonic vibration and is aspirated from inside the capsular bag. The remaining cortex is aspirated with an irrigation and aspiration instrument. Larger incisions require closure with sutures, whereas smaller incisions are self-sealing and may require no closing suture. At the end of the procedure, additional medications such as antibiotics and corticosteroids may be administered. Depending on the type of anesthesia, the patient's eye may be covered with a patch or protective shield. If used, the patch or protective shield usually is worn overnight and is removed during the first post-operative visit. A very small incision is made in the surface of the eye, in or near the cornea. A thin ultrasound probe is inserted into the eye, and ultrasonic vibrations are used to dissolve the clouded lens into fragments. These pieces are then suctioned out through the same ultrasound probe. The small incisions are self-sealing and usually do not require sutures. An extracapsular cataract extraction procedure is used mainly for very advanced cataracts where the lens is too dense to dissolve into fragments. It requires a larger incision so that the cataract can be removed in one piece without being fragmented inside the eye. It does require sutures to close the larger wound, and visual recovery is often slower. Almost all patients have an intraocular lens implanted at the time of cataract extraction surgery. The lens of choice is a posterior chamber lens that is implanted in the capsular bag behind the iris. Antibiotics and corticosteroids may be administered after surgery. As soon as the effects of sedative agents have worn off, patients are usually ready to go home. Postoperative medications usually include antibiotic drops to prevent infection and corticosteroid drops to decrease the postoperative inflammatory response. Recommendations for postoperative activity restrictions and nighttime eye shielding vary based on the doctor's preference. Many still prefer that the patient avoid activities that increase the IOP, such as bending or stooping, coughing, or lifting. During postoperative examination, the doctor will measure the patient's visual acuity, check anterior chamber depth, assess corneal clarity, and measure the IOP. Even on the operative day, the patient's uncorrected visual acuity in the operative eye may be good. However, it is not unusual or indicative of any problem if the patient's visual acuity is reduced immediately after surgery. The postoperative eye drops will be gradually reduced in frequency and finally discontinued when the eye has healed. Multifocal IOLs can correct for both near and far vision. Regardless of the type of IOL used, patients still may need glasses or contact lenses to achieve their best visual acuity. Assess the patient's distant and near visual acuity. If the patient is going to have surgery, especially note the visual acuity in the patient's unoperated eye. With this information, determine how visually compromised the patient may be while the operative eye is healing. In addition, assess the psychosocial impacts of the patient's visual disability and his or her level of knowledge regarding the disease process and therapeutic options. Postoperatively, assess the patient's level of comfort and ability to follow postoperative regimen. Nursing diagnoses for the patient include the following: self-care deficits related to visual acuity. Self-care deficits related to visual deficit. Also, anxiety related to lack of knowledge about the surgical and post-operative experience. Preoperatively, the overall goals are that the patient with a cataract will, first of all, make informed decisions regarding therapeutic options, and second of all, we want them to experience minimal anxiety. No measures have been proven to prevent cataract development. However, it is probably wise and certainly does not do any harm to suggest to patients to wear sunglasses, avoid extraneous or unnecessary radiation, and maintain appropriate intake of antioxidant vitamins like vitamin C and E, and also ensure good nutrition. You can also provide information about vision enhancement techniques for the patient who chooses not to have surgery. Preoperatively, the patient with cataracts needs accurate information about the disease process and the treatment options, especially because cataract surgery is considered an elective procedure. Be available to give the patient and the family information to help them make an informed decision about appropriate treatment. For the patient who elects to have surgery, provide information, support, and reassurance about the surgical and post-operative experience to reduce or alleviate the patient's anxiety. Photophobia is common when administering pupil dilation medications. Therefore, decreasing the room lighting is helpful. These medications produce transient stinging and burning. Also, you can refer to Table 21-3 for patient and caregiver teaching following eye surgery. If a patch is used, inform patients that they will not have depth perception until their patch is removed. This necessitates special considerations to avoid possible falls or other injuries. The patient with significant visual impairment in the unoperated eye requires more assistance while the operative eye is patched. Some patients may require 1 to 2 weeks for the visual acuity in the operated eye to reach an adequate level for most visual needs. These patients will also need some special assistance until the vision improves. Postoperatively, the patient who has had cataract surgery usually experiences little or no pain. Some scratchiness or blurriness may be noted in the operative eye. Mild analgesics are usually sufficient to relieve any pain. If the pain is intense, the patient should notify the surgeon because this may indicate hemorrhage, infection, or increased IOP. Also, instruct the patient to notify the surgeon of increased or purulent drainage, increased redness, or any decrease in visual acuity. A nursing care plan for a patient for eye surgery is available on the website for this chapter. Patients with cataracts who have surgery remain in the surgical facility for only a few hours. The patient and the caregiver are responsible for almost all postoperative care. It is essential to give them written and verbal instructions before discharge. This should include information about postoperative eye care, activity restrictions, medications, a follow-up visit schedule, and signs and symptoms of possible complications. The patient's caregiver should be included in the instruction because some patients may have difficulty with self-care activities, especially if vision in the unoperated eye is already poor. Provide an opportunity for the patient and caregiver to perform return demonstrations of any necessary self-care activities. Most patients experience little visual impairment following surgery. IOL implants provide immediate visual rehabilitation, and many patients achieve a usable level of visual acuity within a few days after surgery. A few patients may experience significant visual impairment postoperatively. These include patients who do not have an IOL implanted at the time of surgery. those who require several weeks to achieve a usable level of visual acuity following surgery, and those with poor vision in their unoperated eye. For these patients, the time between surgery and receiving glasses or contacts can be a period of significant visual disability. Suggest ways in which the patient and family can modify activities and the environment to maintain an adequate level of safe functioning. Expected outcomes include improved vision, ability to care for self, minimal to no pain, and optimistic expectations. Most patients with cataracts are older. When the older patient is visually impaired, even temporarily, the patient may experience a loss of independence, lack of control over his or her life, and significant change in self-perception. The older patient often needs emotional support and encouragement, as well as specific suggestions to allow a maximum level of independent function. Assure the older patient that cataract surgery can be accomplished safely and comfortably with minimal sedation.